Welcome to the hidden world of everyday medications, where even the most commonly used drugs can have their dark sides. Today we're peeling back the layers on one of the most widely used medications globally, paracetamol, also known as acetaminophen. While it's reached for everything from headaches to fevers, there's much more beneath the surface that needs to be addressed. Paracetamol is often seen as a benign painkiller, easily accessible and seemingly harmless. But is it really as safe as we think? The truth is, while paracetamol is effective at relieving pain and reducing fever, its therapeutic window is narrow. What does this mean? Essentially, the difference between a safe dose and a potentially harmful one is not as large as one might hope. The body processes paracetamol primarily through the liver, and it's here that the potential for danger increases. When taken in large amounts, even just slightly over the recommended dose, paracetamol can lead to severe liver damage. This risk is not just theoretical. Liver failure from paracetamol overdose is a leading cause of liver transplants in many countries. But how does this happen? Well, when paracetamol is metabolized in the liver, it produces a toxic byproduct. Normally, this is quickly neutralized by a naturally occurring protective molecule called glutathione. However, in overdose situations, glutathione is depleted faster than it can be replenished, allowing the toxic byproduct to accumulate and cause extensive liver damage. Now, it's important to understand that these risks are not just associated with intentional overuse. Many cases of paracetamol-related liver damage arise from accidental misuse. This can happen when individuals take multiple products containing paracetamol without realizing, or when they use paracetamol in conjunction with alcohol, which can also impair liver function. In essence, while paracetamol is an effective and generally safe medication when used correctly, it operates on a fine line. Awareness and precise adherence to dosage instructions are paramount to avoid stepping into dangerous territory. Remember, the key to medication safety is not just in using them, but understanding them. Stay tuned as we delve deeper into the unseen risks and how to navigate them safely. Did you know that a common remedy in your medicine cabinet could be as risky as it is relieving? Paracetamol, or acetaminophen as it's known in some regions, is a staple in households worldwide. It's found not only in pain relievers but also in a myriad of over-the-counter and prescription medications. What's startling is the narrow gap between the dose that can heal and the dose that can harm. This proximity sets a precarious stage for potential health risks. So, how does something so commonly used become a risk? Let's dive deeper. Paracetamol poisoning occurs more often than you might think. When taken in safe doses, paracetamol is an effective pain reliever. But the line between a safe dose and a toxic one is surprisingly thin. The liver plays a critical role here, as it's responsible for metabolizing paracetamol. Typically, it converts the drug into harmless substances that the body can easily eliminate. However, when taken in excessive amounts, the liver struggles to process the drug safely. Recent studies have illuminated this process, showing that an overload of paracetamol can lead the liver to produce a toxic metabolite known as NAPQI. This substance can cause significant damage to liver cells, leading to liver failure if not addressed promptly. Symptoms of paracetamol overdose aren't always immediate and can include nausea, vomiting, sweating, and confusion. These may seem mild initially but can escalate quickly, signaling liver distress. Recognizing these symptoms early could be crucial to preventing severe outcomes. Recent findings have shed new light on the dangers of paracetamol. As a common over-the-counter pain reliever, paracetamol is often perceived as safe, but recent studies suggest we should approach its use with more caution, particularly concerning dosage. Research has pointed out a significant rise in cases of paracetamol-induced hepatotoxicity, which essentially means liver damage caused by paracetamol overdose. This condition has become the leading cause of acute liver failure in many parts of the world. Studies reveal that each year there are thousands of hospital admissions directly linked to overconsumption of this seemingly benign drug. Digging deeper, the statistics are quite telling. A major study conducted last year highlighted that over 50% of these cases were accidental, often stemming from patients taking slightly more than the recommended dose over several days, not realizing the cumulative risk. Demographically, the most at risk are adults between the ages of 20 and 40. This group tends to engage more frequently in self-medication practices, often combining paracetamol with other substances like alcohol, which can exacerbate the drug's toxicity. In response to these alarming insights, health experts have begun advocating for stricter guidelines on paracetamol usage. The new recommendations suggest lower daily limits and clear warnings about the potential risks of overdose. Additionally, there is a push for better educational resources to inform the public about safe drug use and the importance of adhering to dosage instructions. With this knowledge, moderation and vigilance become key. How can we use paracetamol safely without risking our health? Paracetamol, a common remedy for pain and fever, is widely used around the globe, but its accessibility doesn't imply it's harmless in any quantity. To ensure safety, it's crucial to adhere strictly to recommended dosages. Health authorities generally suggest a maximum of 4,000 milligrams per day for adults. Going beyond this limit risks severe liver damage, potentially fatal. Always check the labels on your medication. Paracetamol is often a component in various over-the-counter products, which makes it easy to accidentally exceed the safe daily limit. Before combining paracetamol with other medications, a consultation with a healthcare provider is imperative. They can provide insights tailored to your specific health needs, ensuring you avoid dangerous interactions. For those seeking alternatives, consider other pain relief methods such as physical therapy, acupuncture, or anti-inflammatory diets. These can be effective ways to manage pain without the risks associated with excessive use of paracetamol. Staying informed and cautious makes all the difference. To sum up, while paracetamol is effective, its safety is often underestimated. It's a staple in medicine cabinets worldwide, hailed for its ability to ease pain and reduce fever. However, the line between a safe dose and a potentially harmful one can be alarmingly thin. Diving into the details, it's crucial to recognize that the therapeutic and toxic doses of paracetamol are perilously close. Just a slight miscalculation in dosage can lead to severe consequences, including liver damage or even failure. Symptoms of an overdose can range from nausea and vomiting to more severe outcomes like jaundice and confusion, underscoring the importance of vigilance. Recent research has shed light on the biochemical pathways affected by an overdose and has emphasized the critical nature of timely medical intervention. Studies underscore the need for public awareness and clearer labeling on medication packaging. Preventative measures are simple yet powerful. Always adhere to dosage instructions, avoid combining medications without advice, and consult healthcare professionals regularly. Remember, the best treatment is prevention and responsible use. Stay safe and stay informed.